I changed a little bit recent advance in spinal cord injury. I retired this February from my university. This is my memorial symposium. So today I will talking about the spinal cord injury recent update. First thing is decompression, timing. The second one is new neuroprotection. Third one is cell transplantation. Fourth one is block inhibitor. Fifth one is spinal cord epidural stimulation. So we have to understand why spinal cord cannot regenerate. There are three problems. First one is central nervous system contains inhibitory molecules associated with the oligodendrocyte and the central myelin. The second one is central glial cell may not provide appropriate physical guidance or chemical factors. I'll explain a little bit peripheral nervous system degeneration. After spinal cord injury, you can see Wallerian degeneration of the distal side and retrograde degeneration of the proximal side. After that, Schwann cell mitosis is occurred. They make a HB band, and then finally axon degeneration occurred. So Schwann cell is very important for regeneration. In central nervous system, central glial cell cannot guidance like peripheral nervous system. The third one is scar tissue. Scar tissue contains some reactive astrocyte, microglia, invading microcyte. They may act to physically obstruct the growing axons and may contain inhibitory molecules. So we can see some scar tissue here. So first one is decompression timing. This is animal study report. All animal study is good recovery in early surgery. But I checked the 10 years ago paper. I can see only two papers, Dr. Papadopoulos, Dr. Sanjiz. They reported good outcome. But recently, Dr. Michael Fanning's report early surgery is better than late surgery. They compared 2 and 3 grade improvement early surgery. The early surgery is better. So after that, I tried within 8 hours early surgery. So I tried since 2012. I can collect only 8 cases. So I showed one case. I can see during for the 8 cases, I can see 4 case improvement. So I show one case. This patient is fall down from 2nd floor. So right side upper extremity trace, all 0. So this is an initial study. You can see fracture dislocation here and the foam fragment in the spinal canal. So I go to operating room. So I reduction of the cervical spine curvature, and then I operate anteriorly. You can see some bone fragment removal, and finally I added second surgery for the fixation. So most of the patient is markedly improved. The left arm, little bit distal part is a little bit weakness. All 3 extremities recovered. So discussion. This is a paper within 24 hours compared. So he conclusion is 24 hours within surgery is much better. The second one is new neuroprotection treatment therapy. The first one, there are three therapeutic strategies: neuroprotection, transplantation, and the rehabilitation. Neuroprotection. So there are three: delusional, minocycline, and hypothermia. Neuroprotection means don't go to the second injury. So delusional is sodium channel blocker. FDA approved treatment of the ALS. This mechanism is delusional, and so this is an experimental study. This not treated control animal. This one is normal animal. So the delusional treatment is much better improvement. In the pathology trauma group, you can see some tissue loss, but delusional treatment, there is no much preservation of tissues. So Dr. Fellings applied this drug for the spinal cord injury. You can see some improvement in delusional group. So 3 months and 6 months, you can see some better result. So Dr. Fellings' conclusion is he applied within 12 hours after within injury. There is no side effect. This is another thing, minocycline. Minocycline it has been studied extensively as protective and possesses action ranging from limiting exocytotoxicity to mitochondrial stabilization. So this is the result, all group. In thoracic and the cervical is better, and in complete and incomplete is better. So his conclusion is cervical injury, especially incomplete injuries, good result for minocycline therapy. So then is hypothermia. So I studied, used my 2001 and 2002. So I used the Peshwar, so I made a C5 code continuum model, and I did the hypothermia group and normothermia. Hypothermia group is 33 degrees. So this cut down and pressure monitoring. This is hypothermia making machines. So result, I can find this normothermia group and hypothermia group. Hypothermia group is better preservation of the tissues, and it is a white matter preservation and this gray matter preservation. So you can see normothermia group is tissue loss is severe, but hypothermia group is preservation of tissues. This is a cell preservation also. I can see this is normothermia and hypothermia group. So I checked the brainstem neuron group, neuron count. You can see great difference between normothermia and hypothermia group. Especially in reticular formation, there is big difference between two groups. This is schematic drawing. You can see small number of the neurons. In hypothermia, you can see many neuron count. This is a behavior test, also improved. So my hypothermia current conclusion is the current study demonstrates that mild system hypothermia is effective in retarding tissue damage and reducing neurological deficit following a clinically relevant conducive cervical spinal cord injury. So my paper was, I received 2008 USA CSRS spine meeting. So I got the best research award. At that time, Dr. Fellings is scientific director. This is the president. This is my letters. Discussion. So I checked the hypothermia application for human beings. I can find 5 papers. So 3 papers come from University of Miami. This is first report of University of Miami, they reported the methodology of hypothermia. They did the system hypothermia. They placed the probe into imperial vena cava. They reduced the temperature of the blood. So they maintained 33 degrees. So they say there's a methodology. This paper is published 2010. They can see among the 14 cases, 6 cases improvement. This is another paper, 2013. They reported 33% improvement of the hypothermia. This is another paper. It's come from Canada and Australia. They reported 20 cases of hypothermia group. They checked the corticosteroid with regional hypothermia. They exposed the cold injury site and the cooling water in and out. So they can see 80% patient 1 more grade improvement. The Dr. Michael Wang, he will collect 200 cases. This is hypothermia. The third one is cell transplantation. So I did Schwann cell transplantation. I studied in 2002 and 1992 and 1993. So this is my study. They were exposed to the spinal cord, and the spinal cord is cut down, and I did Schwann cell sheeted garden channel, and 1 month after, we can see some grafting cables. So I can see valid axons and NCD axons. So this is symmetrical and the Schwann cell plus symmetrical. I can see some valid axons. So I made the C5 code condition model, and then I did some Schwann cell transplantation 1 week after injury. So this hypothermia, this is Schwann cell injection into the contused area. So I did the integrated tracing. So I can see axon count increase and some linear axons. So in summary, I can see preserved axon violation count is increased. PBB is quite slight change, but PBB test improved. This is my conclusion. Schwann cell alone are capable of supporting modest supraspinal axon growth. So after that, University of Miami applied for the human beings for Schwann cell. FDA approved 2012. They did this is a human trial, but they harvest Schwann lobe, and then this is operating picture. They reported Schwann cell transplantation to spinal cord injury. They can see reduce the volume and decrease the length. They can see 3 patient EMG is present. The conclusion is Schwann cell transplantation for the spinal cord injury is feasible. Which we have to wait and see. I got a paper from the University of Miami last February. My Schwann cell and hypothermia work, they can to do FDA approval and clinical hypothermia study. So OEC is also very good. The PBB is a paralyzed man, works again after cell transplant. And then this is Dr. Huang. He did many cases of the OEC. This is Dr. Chang's method for hypothermia, the peripheral lobe and lobe growth spectrum. They did very good result. They did 60 cases. This is much better improved.
Just say the time is over.
Please summarize.
Yes. This is my final update. Decompression timing is as soon as possible. Early surgery is better. There are 3 neuroprotective agents: riluzole, meningocycline, hypothermia. Cell transplantation, Schwann cell, OEC, peripheral grafting, and the prospector is very important. And I skipped this one. Condition ABC is very good result for the spinal cord injury. Another one is epidermal spinal is also good candidate for spinal cord injury and treatment. Thank you.